In this segment, we're going to talk about nonsteroidal anti-inflammatory medications. That includes Advil, Motrin, aspirin, and so forth. Okay? All the nonsteroidals, more on that in a second. So we're going to talk about the side effects. Disclaimer. I'm a chiropractor. I am not licensed to give medication advice. This is not medication advice. Do not change any medications that you're taking, whether prescription or over-the-counter, that you might be taking now that was suggested to you, unless you first talk with your medical physician, okay? This is not medical advice. All right. So the acronym, NSAIDs, or nonsteroidal anti-inflammatory medications, what are those? They are ibuprofen, Advil, and Motrin. Celebrex, diclofenac, Voltaren. Naproxen, or naproxen as some people know it, and Aleve. Aspirin, including Bayer, Bufferin, and Excedrin. All of those are classified as non-steroidal anti-inflammatory medications or anti-inflammatories. Okay? All right. So now, moving forward, I'll say anti-inflammatories unless the research says they're going to separate like aspirin. Okay, here we go. So here are the side effects. 16,500 people a year die because they took too many nonsteroidals. Here's the word, and I've said this for 19 years in this program. Nonsteroidal anti-inflammatory drugs for rheumatoid and or osteoarthritis. Wow, those are common reasons that people take these drugs, right? Osteoarthritis, very common. Rheumatoid arthritis, somewhat common. Conservatively cause 16,500 Americans to bleed to death each year, making it the 15th most common cause of death in the US. Just nonsteroidal anti-inflammatory medications, not drugs in general. Just one classification of drugs is the 15th leading cause of death in the United States. That article came out in the New England Journal of Medicine, basically the #1 journal in the world, in 1999. Okay? So we have known that for almost 20 years now. So that means in 20 years, 165,000 Americans have bled to death because they took too many of those medications. Many people might be taking those medications thinking that they're safe. We need to know that, but let's continue. Conservative calculations estimate that approximately 107,000 patients are hospitalized annually for nonsteroidal anti-inflammatory drug-related gastrointestinal complications. And at least, again, the same number, 16,500 deaths occur in arthritis patients. In arthritis patients alone, just the arthritis patients. The figures of all nonsteroidal anti-inflammatory uses would be overwhelming, yet the scope of this problem is generally underappreciated. The American Journal of Medicine, July of 1998. So again, we have known for 20 years that 16,500 Americans die. 107,000 people a year end up in the ER with a serious gastrointestinal problem because of nonsteroidal anti-inflammatory medications. But that's only for people taking it for arthritis. And the researchers are saying that it's probably underappreciated, which means that these are very low numbers. Wow. Watch this one now. Really pay attention to this one. This is the most striking one that I think people don't know. Okay, here we go. Those who consume the highest amount of nonsteroidal anti-inflammatory pain drugs increase their risk of dementia, including Alzheimer's dementia, by 66%. 66% when you're taking too many of those. That's out of the journal Neurology, 2009. Keep in mind, again, we've known that for almost 20 years. You're significantly increasing your rate of dementia. I mean, that is huge. That is amazing. Okay. Here's another one. This is that link between breast cancer and nonsteroidal anti-inflammatory medications. Okay. Women who took ibuprofen, now they're just saying ibuprofen. Women who took ibuprofen daily for at least 5 years, so that would be considered, I suppose, a heavy user, right? Daily for at least 5 years were about 50% more likely to be diagnosed with breast cancer than those who did not take the drug regularly. Women who took aspirin, now we're moving on to aspirin, women who took aspirin daily for at least 5 years, again, fairly heavy user if you'd say, were 80% more likely to develop breast cancers that were not sensitive to estrogen or progesterone than women who were not regular users of aspirin. That was out of the Journal of National Cancer Institute in 2005. Again, taking these medications, looking at it and saying, wow, this is important information. Some researchers in some research articles said, maybe knocking down inflammation might even help breast cancer. And this study clearly said, no, it's not doing that. Before I get into some solutions for you, it's like, what do I do? I mean, I'm taking these drugs to feel better. We'll get into that in a second. This is expanding our discussion now, just as a review. Taking the correct drug and for the correct diagnosis and the correct dose will kill about 106,000 Americans per year, making it the fourth most common cause of death in the United States. Those are all drugs. Again, that was out of the Journal of the American Medical Association, 1998. We've known that for 20 years. Taking the right drug for the right diagnosis and the right dose, meaning no one made a mistake, that conservatively kills 106,000 Americans per year. Okay. Chiropractic spinal adjusting. This is one of the solutions for people, the possible solutions. Chiropractic spinal adjusting has been shown to be better than 5 times more effective than non-steroidal pain drugs, Celebrex and Vioxx, in the treatment of chronic neck and back pain, Spine in 2003, Spine being the journal. If you remember me talking about this article, chiropractic went head-to-head against Celebrex and Vioxx. And by the way, Vioxx was taken off the market. Why? Vioxx killed more people in 5 years than the Vietnam War did in 10 years. 60,000 people in 5 years killed by Vioxx, so it was taken off the market. But as you can see with everything I'm talking about, the other drugs aren't safe either. Remember now, chiropractic went head-to-head against Celebrex and Vioxx for chronic low back pain, not acute, chronic low back pain. And chiropractic was shown just in 9 weeks. We were better than 5 times more effective than that. Not only that, there was a follow-up study 1 year later that said chiropractic was the only one that showed long-term pain relief in 5 of the follow-up qualifications, where the drug group only had betterment in 1 of the follow-up qualifications. Pretty powerful stuff. Glutamate and aspartame, so now we're moving on to a food substance now as a cure for this, can cause chronic pain sensitization. And removing them from the diet for 4 consecutive months, only 4 months, can eliminate all chronic pain symptoms. Annals of Pharmacotherapy in 2002. Glutamate and aspartame, basically everything that's diet soda, diet drinks, diet foods, anything with the sugar removed, but they've added glutamate and aspartame. When they add the fake sugar and you're drinking it, you're cranking up the sensitivity of your pain nerve endings, making you more apt to have chronic pain. I remember my colleague, Dr. Murphy, had a woman come into him, and she was in her 30s. And on the history form, he has a piece of it, which I do. It says, do you drink soda, and do you drink diet soda, and how many per day? If I remember correctly, she was drinking 6 diet sodas per day. She had chronic pain, nobody could figure it out. He said, do you want to get better? She said, yeah. He said, knock out the soda. She did. Chronic pain solved. So get rid of the diet stuff is a good recommendation. Good recommendation. Moving on to now a supplement. In patients suffering from chronic pain subsequent to degenerative spinal disease, do you know anybody that has degenerative spinal disease besides everybody? 59% can eliminate the need for pain drugs, 59%, by consuming adequate levels of omega-3 essential fatty acids. Fish oil. Surgical Neurology, 2006. Catch the journal. Surgical Neurology is saying 59% can eliminate the need for pain drugs by just taking some omega-3s. We can even do better than that. We can get the omega-6 fats and oils and inflammatory foods out of our diet, crank up our omega-3 foods, lean greafy vegetables, cruciferous vegetables, and then adding some cold water fatty fish. And then you can take some fish oil supplements. Just about 60% of people can remove their chronic pain by just doing that. So in conclusion, what can we do instead of taking the pain drugs if you want to have alternatives? I say chiropractic. Remember also, we went head-to-head, chiropractic went head-to-head with diclofenac, another non-steroidal anti-inflammatory medication, for acute low back pain. So people came in with acute low back pain, they had the chiropractic group, they had the diclofenac group, chiropractic won again, substantially. So I recommend the chiropractic thing, give it time. Number 2, I recommend the clean diet thing. Eat an anti-inflammatory diet. I think everybody knows what they should do. Eat things that don't taste good. Stop eating things that taste good, including that diet stuff and diet soda and so forth. Regular exercise. Move your body, stimulate chemistry that knocks down pain. Get enough sleep. That's when the body repairs. Reduce your stress. It reduces pain chemicals that increase pain sensitization. Drink enough water, but not too much. Anti-inflammatory supplements. We already covered the omega-3 essential fatty acids in fish oil. Take antioxidants. Take magnesium. Take probiotics. Take these things under a doctor's supervision. Make sure you talk to your doctor as well before you're doing these things. Also look at if you're taking blood clotting medications and blood thinning medications. Be careful with that when you're taking fish oil, because you have to talk to your doctor first and limit your doses. I'm Dr. Scott Fuller. Join me again.